خلاص نبدأ المحاضرة بعد ذاك. بالنسبة للناس اللي ما قدروا انه يحضروا كده، فالمحاضرة ده يعني هو التسجيل ده مسجل. التسجيل ده انه التسجيل ده مسجل، والرابط بنضعه مثلا في المنصة في كلاسيرا، موقع بتاع الجامعة. بكون اكسس لكل الناس وكده يعني. وايضا برضو الماتيريال برضو نحطه برضو في كلاسيرا وكده. فإذا لو عنده سؤال بعد ده ممكن later on ممكن يسألنا كده يعني. فخلاص نبدأ. As I mentioned, we are going in our courses which is focusing in the public health law. This course is considered as a critical framework that can help us as the health professional to protect and promote our community health. Uh, this course is have the in semester six, as you know. Additionally, it's 2 hours. Duration is going to take like 16 week. But this week it is consider all of perhaps include the time of the exam and also for the seminars. All of this. And now let us to see the objective of these courses. By we have the general objective of this course, and let us to go through the objective of this lecture. One of them define the public health law to understand the importance and fundamental of the public health law. This is the one objective. Second objective, understand the key domain of the public health law in Sudan, which identify the differential between the health protection and disease prevention, and also for the health promotion. Third objective of this lecture, recognize legislation law rule, to know what does mean the legislation and what the exactly rule of the legislation. Moreover, you can identify the major Sudanese. As you know, in public health law there is many laws. One of them is the Food Act 1973. Additionally, there is the law of the Environmental Act 2003, Public Health Law, and also Environmental Law 2009 and 8. This is the main law we are going to focus in it during in our lectures. Now let us to see what are the public health law. What does mean public health law? The public health law is a set or rule of regulation that has been established by the government to protect and prevent and promote the community health. And this law is focusing in the four fundamental action or four foundation action. One of them is the protection of the community from the white spirit. When we have the law or protection of the community, that means how you can protect our community from the chemicals, and also can protect our community from the things that can affect for their health. This is the one of the foundation of the public health law. Additionally, prevent the spread of the disease epidemic. Yeah, there is a law of the public health law that's focusing on how we can prevent our community from the outbreak or epidemic. As you know, one of the epidemic or recent epidemic like right now take place in Sudan is the cholera. By the law also that can help us to prevent our community. Moreover, the promote healthy behavior and lifestyles like the alcohol handling, and also cigarette prohibit the cigarette among the or in public place. This can promote the behavior uh, of our community. That's foundation of the public health law to ensure safety standard for the vital resource like food and water. As I mentioned before, right now the cholera take place. Cholera is taking place to do our community to be safe. It's very important to use the law of uh, prohibit the adulteration food, and also to prevent from the bad or contaminated water. This is a what is the public health law? This is a fourth foundation. One of them is to protect our community, prevent the spread of disease. Additionally, promote the health of our community. Lastly, to safety standard or to ensure the safety standard of our community. Uh, I hope. Do you get this slide very well? Hello, you hearing me? Hello, hello.
Yes, I heard you, doctor.
Okay, okay, thank you. My voice is it audible and also clear, or there is a? Do you get it or understood this?
For me, there is no issue.
Clear,
Okay,
yes. No problem.
okay, okay, good, good. We can continue. This is the first slide, which focusing in the what is the public health law. As I mentioned, is the regulation that put it by the government to protect and improve the community health. And I mentioned the focusing on the four foundation. One of them is the protect the community. Second, prevent spread of disease. Third is the promote health of our community. Lastly, to ensure the safety standard for the vital resource like food and water. Now there is the three pillar or key domain of the public health. One of them, the health protection. This is one of the very important pillar. Health protection, which is focusing in the safeguarding of the community from environmental hazard to ensure the clean water and air. Additionally, to regulate the food safety and sanitation. The protection, how you can save our community from the community hazard. Now, or you can see sometimes when they're established like factories or industries, they emitted like chemicals substance in the air, or even they can discharge the wastewater in the land, or also they can discharge in the water stream, or in the ocean, or in the sea. All of this can affect the our health by direct or indirect. Yeah, can affect for the in the microorganism. As you know, the all of the microorganism is important in our life. How you can they can help us to do the diversity of the environment. Yeah. By this law, we can safeguard, or we can save our community from this pollution. This pollution, perhaps air pollution or land pollution, and also can water pollution. Yeah. But there is a some law of Sudan. In Sudan, they call it Environmental Protection 2001 is focusing on the how we can protect our environment. Yeah. Additionally, there is another law of the public or environmental health law for the 2009 is also focusing on how we can save of our community water and land and also air. This is one of the main pillar of our public health law. Our second pillar is the disease prevention to stop of the disease. As you know, right now the cholera take place in Sudan. There is a many people has been affected day by day, and also many people they are suffer by the law when we do the mandatory of the vaccination, like for the in the childhood, the mandatory for them to give or to receive the vaccination. This also can prevent. Additionally, there is a during the traveling, if you need to travel to another country, they request to have you must have the or you must vaccinated from the COVID-19 or yellow fever or the some else uh, disease. Yeah, that is prevent. That's why to prevent the community. When you are affected by some disease and not vaccinated, that by easy way can spread this disease to another people. Yeah. Second point of the disease prevention implementation quarantine measurement in the in the traveling of the people. If there some people need to travel outside Sudan or coming in Sudan, they have to implement the quarantine measurement. Uh, must make sure these people that come from out or traveling to out to receive the obligation or mandatory vaccination. That's why to prevent. As there is in the public health law 2008, also there is a request for the mandatory vaccination for the traveling, especially those people that come from the epidemic area. They must receive the vaccination that can reduce the spread of the disease. Yeah, this is the two pillar number two for the disease prevention. Last one is the health promotion. How you can upgrade the health of our community to encourage the health people to our community to receive the public health campaign. Also, the policies like in some countries they request for the schools to do the exercise and also to provide them the nutrition service at the school. All this can promote the health of our community. This is the pillar. This is the three pillar of our three pillar that the public health law depend on it. One of them, health protection. This is the one, and this mainly focusing how we can protect our resource from the pollution, like water or or land or food or sanitation. This is the call it the health protection. As I mentioned, example of this, the Environmental Act in 2001. Second pillar for the public health law is disease prevention. Third one, health promotion, how you can upgrade the health of our community. This is a domain of the public health, depend on it. Now let us to go to next. Health, please mute yourself. Mute yourself for those have noise around. Yes. Now let us to go deeply. As we mentioned, the public health there are three pillars: the protection and promotion, and also for the and prevention. This is the pillar. Now let us to go to health protection. Example for from Sudan. Law in this domain is crucial to ensure the environmental we live are safe and free from contaminant. They focus on preventing exposure to harmful agents like Environmental Health Act 2001 reg- regulate pollution and waste management and sanitation to protect natural resource and public well-being. Secondly, food safety regulation establish standard for the good production and handling and distribution to prevent foodborne illness to ensure the consumer safety. As I mentioned, the example of the public or health protection law in Sudan, uh, they focusing they are focusing to ensure the safety of the environment and environment to be free from the contaminant. In this picture, you can see the stream, the stream. But there is some country that discharge the wastewater in this stream. For the health protection, they request for those industries when they need to discharge they the wastewater, it is not going to discharge directly to the stream. They must treat this wastewater firstly. After that, they can discharge. Yeah. This is one of the protection because if they discharge that wastewater directly to the stream, the many organism like fish and also many organisms inside this water will lose their life or they can damage. Yeah. Additionally, also this water will be contamination. Even the people, it is difficult for them to use it. Yeah, this is the one of the example. Yeah. Additionally, this is the Environmental Act in Sudan. There is the Environmental, as I mentioned, 2001, regulate the pollution, waste management, how you can manage your waste. Yeah, solid waste, how you can manage it. Yeah, before disposal at some place, you have suitable place to prevent the environment. Additionally, sanitation is very important, as I mentioned example before. This for protect the natural resource. Lastly, for food safety and regulation, establish standard for food protection and handling. Even at the industrial level, you have to regulation to see the material that people use it in industrial. Is it good with the health or not good? Additionally, handling the way of transportation or to buying or to movement this food also will be in standard distribution of the food to avoid them from the contamination. Yeah, this is a second. This is an example from Sudan for the how we can by the law we can protect the health here. This is the example. I hope this slide is clear. Now let us to see the second pillar of the public health, disease prevention. Example from Sudan. This law aim to hide and spread of disease through proactive measure, protecting individual and wide population. Number one, vaccination law mandate immunization for the children entering schools. Additionally, build community immunity against preventable disease like measles and polio. This is a vaccination law. Another law is for the quarantine. The grant authorities the power to isolate individual or group infected with highly contagious disease as seen during the COVID-19. Yeah, this is the prevent the disease from our community by the law. There is a public health law focusing on this here. One of them, vaccination law, is a mandate immunization for the all children entering the school. Yeah, the request from the any children when he need to join to school, they have to vaccination card to make sure that child have received the vaccination dose. Also, building community immunity against preventable disease like measles and polio. That means this is a some campaign for the all community or national vaccination, yeah, or all community gives them the vaccination like polio and measles, yeah, to raise the immunity of the community. This is for the vaccination. Second one for the quarantine. As you know, the quarantine or international regulation 2005, yeah, also they mentioned they give the authorities and power to the people and also to the Ministry of Health to make cross check with those people need traveling or they are coming into Sudan to make sure not have the sign or symptom of the contagious disease, and additionally he must have the vaccination card, yeah, especially when he come from the outbreak or from the epidemic area. This is a this is a law. This is the second pillar of the public health. They are we are used law to perceive or to prevent our community. As I mentioned, disease prevention, vaccination law, and quarantine law. Now let us to go to next slide. This is a last pillar or health promotion example from Sudan. Health promotion law encourage positive health behavior. Is the promote the positive health behavior. That behavior can let us to save our health good. This is the quality of positive health behavior and create positive environment for healthier choice. Yeah. Like tobacco control law prohibits smoking public places. Now in Sudan, there is a tobacco health law to not allow the people to do the smoking in the public place here or public space here to reduce the exposure of the other people to the smoke, yeah, or to this smoking. Yeah. And addition, expose taxes to tobacco product. There is a high taxes for the tobacco products that can lead to discourage the tobacco company to reduce the manufacturing of the tobacco. Also, schools health act mandate health education. Yeah, it's mandate to give the health education for the people is during in the health. Additionally, promote physical activities. Yeah, sometimes they give them the time for the export or expertise, and ensure access to natural food in schools and fostering health habits. Yeah. All this is considered as a health promotion. Now let us to go to the why public health law is important. This is the question. To answer this question, it's very important. The public health law help us to prevent outbreak, like when the request from the authorities to follow the measurement or precaution of the breakdown of the disease. Yeah. One of them, as I mentioned, preventable outbreak is crucial in containing disease like cholera and malaria, safeguarding community. Yeah, it's requesting right now. As you know, there is a outbreak take place in Sudan. The request from them is mandatory to use the precaution like clean your hand and also use not buy the food from the open food from the market. This is one of the by law that can help us to stop this kind of the outbreak if they follow the precaution. As you see in the COVID-19 time, there is a lockdown. It is not allowed the people to it is not allow the people to traveling between the countries, to reduce the exposure of disease or to reduce to reduce the spread of the disease. This is one of the public health law to prevent the outbreak. Secondly, protect vulnerable group like children and also elderly and also work from the specific health risk. Like what protect children as they do the mandatory of the child before to join to school to have vaccination to have the to receive the vaccine. Additionally, for the elders, also for the health worker from the specific health risk, those people that are working in the very risk chemical area, they request from them to work specific time. Additionally, it is not allow them to for the industry not allow them to discharge the chemical material direct to the stream, water stream, or some rivers. Yeah. Ensure the fairness, guarantee the equitable and accessible to essential health service and resource for the all citizens. Last one, control hazards, mitigate the risk from the environmental pollution and unsafe working. This is considered why the public health law is important. One of them, prevent outbreak, protect vulnerable group, ensure fairness, lastly, control hazards. Case study, the Law Act for the Public Health 1975 is the foundation act empowering Sudanese government with broad authorities to control infectious disease, inspect healthcare facilities, and regulate public health practice, real, uh, including the burial protocols, underscoring the critical role for the law of national health security. This is the example of the public health law. They are important. Now let us to see the major major public health law in Sudan. There is a many of public health law in Sudan. One of them, Public Health Act 1975, cornerstone for legislation and government disease control and hospital administration and general health service delivery across the country. Secondly, Environmental Health Act address the pollution and waste management and sanitation, aim to preserve environmental quality and prevent the health hazard. Third act is the School Health Act, focusing on the creating safe and healthy learning environment, promotes the student well-being through the health education and service. Five or fifth, Pesticide Insecticide Act regulates the use of the chemical in agriculture to prevent the harm to human health and environment. Last law for the tobacco control law. During this course, we will go deeply, because in any law we can go deeply to see the regulation and also the article and items and offense in each law. We can go deeply. Yeah. During that time, can let you to understand very well and understand the different this law. Yeah, yeah. This is last. This was last slide. This one, role of the public health provision for this is the last slide. Role of the public health provision. Public health professional are the vital translating law into action. The professional role to translate this law from the books or from the to the practical, yeah, and the effective on the ground. Enforce laws, conduct the food inspection, and ensure workplace safety and upload sanitation standard. Secondly, monitoring report. Tracking disease outbreak, collect data and report the case to inform the public health response. Additionally, to educate the community, raise the awareness about the hygiene practice, and promote vaccination and dissemination crucial health information. Last rule of the public health professional, advocate for policy. Champion stronger public health law and policies such as anti-smoking initiative and improve the environmental regulation. This is the role. As we, all of us, like a public health professional, in our rules to enforce the law of inspection and environmental to prevent and to save the life of our community. Additionally, we can monitoring the report, monitoring the report of tracking of the disease, outbreak, data collection, report cases, all of these, these also our roles. Yeah. Additionally, the educate community, raise awareness, let to upgrade the awareness of our community. Last one is the advocate policy. How you can do the advocate to all this law to be applicable or to be practice to be more practical. Thank you for all of you for this lecture. If there any question, the floor for you. Now you can ask if you have any comment or explanation or question. The floor for you. Yeah. Thank you for your attention. Yeah. Is there any question or comment? Hello?
Oh, adik. Oh,
Hello, hello, yeah.